So after today's session, we hope you will leave with an increased knowledge of substance use related trends, an increased understanding of myths and misconceptions regarding substance use, and increased awareness about issues of concern based on statistics and data from the Rappahannock Rapidan region. And with that, I will turn it over to Dr. Jan Brown of SpiritWorks Foundation. Thank you.
You're very welcome. And I am Jan. I know a lot of people, I tell them when I'm wearing my collar, I would be Reverend Brown, but Jan works just great. And as Bridget mentioned, please put questions in the chat. As conversational as this can be, I would love for it to be, if I'm using, what do you call those things? Acronyms, which I don't typically do, certainly feel free to stop me. I was telling Bridget earlier, some of this is hot off the press. Some of the things we just learned yesterday around emerging threat. And so I'll be talking a little bit about that. So again, thank you. And we will also leave some time at the end for any questions and responses that come up. But again, if throughout I don't want folks to kind of miss as we move forward, if there's something particularly that we need to pause and highlight or pause and clarify. So what we're going to be talking about is some of the current trends and issues in substance use, specifically to where you all are, and some of the kind of the larger issues that are impacting the region that we're talking about. And the first one is, and this came out yesterday, and I'll have a slide that's got some of the press release that came out, but it's an emerging threat. And this is a combination of the pharmaceutical medication xylazine, which is for animals, that is being mixed with fentanyl and has now been raised to the height of an emerging threat, because there are so many people who are now dying from their use of xylazine and fentanyl. And we'll talk a little bit more about some of those nuances and what makes that such a deadly combination. And so who you see on the right is our drug czar, Dr. Gupta, and I had the good fortune of being at a meeting at the White House with him back in September of last year for Recovery Month. And this is what he said yesterday, that he's deeply troubled about the devastating impact of that combination. And that he's concerned what that threat might look like for the country that we're living in, and more specifically for Virginia and the region where you all are physically right now. And this being in the midst already of a fentanyl epidemic, so to add this piece of xylazine to that mixture is extremely dangerous. This came out in March of this year, at the end of this year. And some of the highlights on here are that it's not approved for use in humans. And so, the fact that people are able to access this and mix it into drugs is even more scary, because it's not something that we ought to be able to get in the first place. When people are getting it, kind of some of the street names that you hear, primarily you will hear trank, that's how folks are purchasing it. That's what people know it as. Sometimes you hear xylazine dope is another mixture or another way that it's referred to. What makes it that particular combination so dangerous is that naloxone does not work for xylazine. Naloxone works for opioid overdoses, so fentanyl, certainly heroin, and prescription medication that are narcotics, it works for, but it does not work for xylazine. We also are starting to see with xylazine is kind of the impacts on skin. So we're seeing sores, skin ulcers, to the point that people are requiring amputation. And so it is very, very difficult to to really help folks. I mean, the best thing that we can do when we encounter someone is certainly to use the naloxone, because it's that combination of the xylazine, which is going to slow somebody's heartbeat and slow their breathing, which is exactly what happens when somebody is taking fentanyl. And so that's where that combination or mixture, if you will. I pulled a couple of articles that I had been reading. I sadly keep a collection of these things, just so that I really do know what's going on. For those of you who don't know, we have an office, a physical center in Williamsburg, and we also have a recovery center in Warrenton. And so we pay attention quite a bit to what's in and around. One of the things that we know with people who use drugs is that they don't know, somebody in Culpeper may not know that they're physically in Culpeper, and it certainly doesn't mean that a person won't go, from Warrenton or Fauquier to Culpeper to buy or to use drugs. So the boundaries and the lines that separate counties and cities is pretty arbitrary for people who are using drugs. They're willing to go wherever the drug is. And these days, those who are selling and dealing the drugs are willing to go wherever the person is who is going to use them is, in order to make that exchange. So this one was from January of this year. The Culpeper man and others who were sentenced to 9 years, they had both fentanyl, they had methamphetamine. And so again, what that lets you see is both of those are in your area. They're being distributed. And thankfully, people are getting caught for doing so. But it's a good bit of drugs. I mean, thousands of counterfeit pills can do a tremendous amount of damage to certainly the individuals, their family, the community, and beyond. This one was March of this year. Again, this was a Rappahannock County man who was arrested, and he had powder cocaine, he had methamphetamine, he had crack cocaine, fentanyl pills, a great deal of money, and a vehicle that was seized. And so, that person lived, was dealing out of a Culpeper residence, even though it was a person who was from Rappahannock County. This one is, again, this was Fauquier, and it was a drug bust that led to multiple arrests. I chose not to put the people's names up here, but nonetheless, that information is available. Even addresses, people are letting folks know as a way, so that the transparency that I find in and around, the 5 counties up there, I think is one of the strengths of the area, because, it really shows the investment of those who are doing the arresting, being the Blue Ridge Narcotics Gang Task Force. And we'll talk a little bit about who they are and where they're coming from. But they're doing a tremendous amount of jurisdictional work. Here again, we're seeing pressed fentanyl pills, we're seeing crack cocaine, powder cocaine, we're seeing methadone, we're seeing marijuana, we're seeing handguns. And then of course, we're seeing large amounts of cash. That those are the ingredients that are showing up. This one, although is from 2020, when I was talking to Bridget earlier, I said, I think it's important that people know what is and has been, right there. This is from a gas station, I think, that started selling these items in 2012. So this gas station is located in Warrenton. It's a Gainesville man who was selling synthetic cannabinoids. And so what that is spice. And my reason for really sharing this is one, that that in the gas station and right around the corner, they're selling spice. A lot of times people think it's somewhere else. Some of the brand names that you hear: Scooby-Doo, Diablo, Bizarro, 24 Monkey. Spice costs $53 a packet, so it's not cheap. But it's, here are some of the other things that you're seeing. And there are claims that this is not marketed to children. I have a hard time when I'm hearing about rainbow fentanyl, and that looks like something that the top right looks like something that is really marketed to a child. Nerds as a type of candy, and they're typically multicolored, almost little pellets or beads that is normally in a Nerd's package. But here you see an actual image. These 3 images were not taken from arrests or paraphernalia that has been found specifically in Fauquier and Warrenton and Rappahannock. We know that rainbow fentanyl is there. We know that Scooby snacks are there as well. And what we're starting to see with Skittles and some of the other things that we're finding is, one might not ever know. You see the rainbow package and you make the assumption that this is the Skittles that you would get anytime you went to the drugstore, to the gas station, to the convenience store. And so we're having to really look closely and carefully, why people would buy medicated Skittles. So that's a clue. And then you see on the bottom left, the triangle shows you the marijuana leaf. And so, letting folks know who are in the know, who want to purchase these items, see that they're there. But for those of us who don't necessarily know, and we're coming to get some Scooby snacks, or we want Skittles or Nerds, it's very dangerous to not know what you're purchasing. And we certainly have seen during the during the Halloween time that there was an increase in overdoses and sickness among children and youth who had gone, trick-or-treating because they were coming home with some of these types of packages. We saw that in far southwest Virginia. We saw it happening in Richmond, Virginia. To date, I have not seen any or read of anything in Warrenton or in the region that was specific to you all about sickness and about the Halloween time. However, I think that if we did, we made a visit to some of the stores that we know where they sell these things, I imagine that they would be there. Several years ago, we worked with a gentleman, Tall Cop Says Stop, and he periodically goes throughout the Commonwealth and other places and just kind of helps us see what's there and what's not there, and so it's really helpful to be aware of what's right there in your backyard, so to speak. This is another Delta 8 is a huge trend that we are seeing, and still in Virginia, it is legal. Once we get to July 1st, there's a bit of regulation, the amount of THC. So stores would be allowed to sell it if they register, and if it only contains a certain percent, I believe less than 3% of that particular cannabinoid, then you can buy it. But right now, you can go in the store. Pharmacies have it. We see it in shops where you see the Kratom banners, and head shops and some of the dispensaries and those kinds of places are selling Delta 8. There is no minimum age yet that somebody has to be in order to buy it. The symptoms, the high, if you will, is very much like a marijuana high. And certainly some of the problems are, children and youth getting things like, you're looking at Pebbles, you're looking at Cinnamon Toast Crunch, you're looking at Rice Krispies. But again, notice at the end of these, Rice Krispies has a Z. Apple Jacks has that Z. Fruity Pebbles has the Z at the end of it. And so it's kind of, code that people who are purchasing it look for because that's what they want. Most of us wouldn't, again, think twice because we're familiar with the packaging, we're familiar with the way that it looks. And so we really think that we're getting Lucky Charms, magically delicious. Because, we just may go right in and say, there it is, or there's, oh yes, Rice Krispies, there it is. And we would take it and we would bring it home, and or our children would go in and take it and bring it home. The one that you probably can't see very well is we call them gummy bears, I think is how they're referred to in the United States. Gummy bears, again, with a Z, and how innocent it would be to just go and pick that up, thinking that you're going to, enjoy gummy bears and then get very ill, potentially overdose. And so they're causing a tremendous amount of problems. Delta H has not been approved by the FDA for anybody's use ever. And so again, keeping it away and out of reach of our children, of our pets, of ourselves, as we are not expecting to get that. What will happen with the law in Virginia is it'll begin to be, with that regulation, it'll be a little, it will allow them to begin to do some evaluation and studies around it. But we know this stuff is being manufactured in any old place, and, they're not using standards by which to manufacture it. And so, you never know what you're getting. You don't know what the substances are that they are binding it with and putting it in combination to. So definitely see that in your area and know and kind of pause when you do see it, and make sure not to scare your loved ones or to scare you, but it really is about being educated and informed on what's there. It's difficult because we have made the attempt to address, to start off with, we try to address, and then we get a little bit more firm and question why some of these stores are selling this stuff. And most of them have a reason that they tell us. They'll tell us that they're not marketing it to children. They'll tell us all kinds of different things. And you won't ever convince me that this particular packaging is not set up for children to be able to access. Here's another image of things that have actually been found. So again, looking at your Snickers, your Payweed, your reefer cups. And so they all also have their own kind of nicknames that go along with them, that people who are purchasing them and looking for them know what they are looking for in purchasing. Those of us who don't, need to pick up that candy bar and look at it a few times before we purchase it and take it to the store or give it to our children. There have been some instances where an unknowing parent, bought that Snickers candy bar, took it home, gave it to their child, took it to the car, gave it to their child, and their child became very sick. And so again, and the response, if anybody ever comes across this and gives it unknowingly to their child or takes it unknowingly yourself, is to call poison control. I encourage people for that to be the first call, and then 911 as necessary, but certainly calling poison control so that you can let them know the symptoms. Poison control usually also knows what's in different areas, because they have received phone calls about different things that are there. So by making that phone call to poison control, they can often begin to say, okay, you need to definitely go to the emergency room. You need to drink a lot of water. You need to make sure that this person doesn't get drowsy. You need to make sure that you're not driving, because one of the side effects is drowsiness. I'm going to pause for a second. I see something in the chat and didn't want to leave it behind. I wish there was some age group for energy drinks. Absolutely. Yeah. Yes. That's a dreadful another one. Been around for a long time, and the folks are just there to make money. Sadly, the people who are peddling these things to the children and the young people are in it to make money. They don't care, frankly, about what happens to the people who are using it. They see it as a source to make money. Kratom, you all have many shops. And if you ever gone to the beach or some other places, there's these really tall flags, and you'll see they say Kratom. So that those shops are selling Kratom. You see them, they say Delta 8. Just drive Route 17, drive Route 15. Get on there's some of the gas stations, just driving around town and around the county, you will see those flags that say Kratom. You will see the flags that say Sativa. You'll see the flags that say Delta 8. And just a little bit about Kratom, it is an herb. It has therapeutic use. It has not been approved by the FDA. How people use it in teas. For a long time, it was rampant in the recovery community as a way for people to withdraw from and manage their opioid use cravings, to manage their symptoms, to manage mental health problems, fatigue, pain, all of those things, because it has opioid-like properties. What we now are seeing people do is to misuse Kratom, to become dependent on Kratom. And those that we've known who've come to the centers looking for support will tell you that the withdrawal from Kratom is, worse than heroin ever is. And yet, we're seeing people become dependent on it. We see some tremendous side effects that go right along with it. Not to the extreme of death necessarily, but a lot of respiratory problems, psychiatric problems, heart problems, stomach problems. These are all associated with what is in Kratom, and the fact that people who are using it to get high. And sometimes, again, it's a difficult one. It's a very expensive one to detect. And so that's another reason why people who use drugs use it, because the likelihood that you are going to test positive with Kratom and then be punished or revoked or, whatever the case may be from your probation officer, from your job. I mean, if your job is doing drug testing, more than likely they are not going to drug test for Kratom. It's very expensive. It is something that can be done. And so, but again, they're selling it in the stores. And so many people think, oh, well, there's nothing wrong with this. Here it is. They're selling it in the stores. And as we've talked to some pharmacists and pharmacies, particularly around Delta 8, and trying to encourage, persuade, cajole, beg, I think that's about as far as I've gone, them to stop selling it, they will tell us of the good uses that it has and the properties that it's used for. And I imagine that there are people who probably are purchasing it for that reason. And when you look at some of the packaging and some of the other things, it's very enticing to young people. And for those who, maybe in some phase or stage of addiction, some phase or stage of recovery, when they hear about it, they're starting to take it as well. So some of the things that I think that are really amazing, that again, around that issue of transparency, right? So every single day, the sheriff's office, I didn't look at it today yet, but this is from yesterday, puts out a daily activity report of what they've done and what they've seen and how they've responded. And they do it for all of the different jurisdictions. I only pulled the one from Marshall for no particular reason. So not trying to pick on Marshall in terms of a district, but because all of them are there, and you can just take a look. Were there any arrests? Were there any felonies? Were there any overdoses? And also, as you see there, a lot of times when you hear the word overdose, people assume death. Now, I think people are becoming more and more educated and able to say, okay, was this an overdose death or was this an overdose? And certainly not necessarily with the police or the criminal justice system, but we do ourselves and family members and individuals, people who use drugs, a disservice by calling them overdoses. That's more of a community-based term, an individual-based term. But when you're putting something in your body and you don't know what it is exactly, you're being poisoned. And so when we see the medical side of this, it's called drug poisoning. That's what these deaths and these overdoses really are. When you are using xylazine, which is not for human consumption, you are being poisoned. There is no proper dosage for a pressed pill that somebody is selling you. I think I made it in my slides, but I'm not sure. But we often talk about the chocolate chip cookie effect, and I could use a different one. I'm not a big chocolate chip cookie fan, but that's beside the point. But if you get a chocolate chip cookie, no two chocolate chip cookies have the chips in the same place, in the same consistency, or any of those kinds of things. And so I often talk about to think of fentanyl like a chocolate chip cookie, that in some parts of the cookie, there may be lots of pressed fentanyl. In other places on the cookie, there may be none, which is why a person could get pressed fentanyl from the same pill, and that some people may die or have symptoms and other people may not. And it's because that it's like a chocolate chip cookie. And if you take a piece of it, you might get 5 chocolate chips. You might get 1, you might get none. And so that's why we can see such dramatic differences in what is happening among the people who are using these drugs. But these are, this daily activity report is remarkable. And as you see, it's unclassified, it's for public release. The sheriff's office wants the citizens to know what we see, what we're doing, what we're responding to on a daily basis. And then, of course, it also keeps a far better running count. There's a lag in Virginia. I went to pull the numbers for you all for the counties there, and we still don't have last year's data of fatal overdose deaths, different drugs that are there. So there's at least a 6-month lag behind, what's being reported that's going to come back out of the Commonwealth from the medical examiner's office. So the fact that, this information is being put out every day, allows the response to be more effective, more targeted than where we are getting, we talk about lead data and lag data, and medical examiner data is definitely lag data. It's difficult to respond to a bad batch of drugs when the information isn't put out there until 6 months later. We could read that daily report and we could see that, there were X number of overdoses, yesterday or on the day when they were actually happening. Let me look at my chat here. I wish all counties, yes, me too, D. Fleming. I wish all counties were as transparent. It's one of the ways that, has really allowed, Fauquier to turn the tide in ways that even some of the surrounding, next door counties to yours haven't been able to get ahead of it. Now that there's this xylazine, though, it's been really, really quite frightening. I mentioned earlier the Blue Ridge Narcotic and Gang Task Force. Again, for me to look at all of the different folks who are here from Rappahannock, Culpeper, Orange, Madison, Fauquier, sheriff's office is present, police departments are present, really says that this is a jurisdictional effort to address the problem. And what it does as well is it brings more resources to bear. One county or town trying to go at this problem alone isn't going to make too significant of an impact because of resources, any number of types of resources, personnel, money, equipment, on and on and on. And then to have the support of the Virginia State Police on top of that, again, is one of the reasons why some of these bad players and dealers are being caught, and being caught these days before we're seeing a lot of overdose deaths in the region, which has been extremely helpful. And again, we also have to remember these are deaths and overdoses that are reported. If you talk to folks in the sheriff's office or you talk to people in the police department, they will tell you that they're not all reported. And so, there truly is an underreporting mechanism. However, the good work from the slides that I showed you earlier, there's a lot of drugs that are there. And so, the fact that they're catching them and they're catching them before large numbers of people. I know in some of the surrounding counties, just north of where you all are, we're seeing it in the high schools. We're seeing overdoses in high school. We're actually also seeing overdose deaths in high schools behind the combination of fentanyl and xylazine primarily. And so it's a scary thing. I've met with a couple of young people who are scared to go to school because they see bodies being wheeled out of their school, and they're learning that friends, classmates, people who go to school with them are using these things in the bathroom, and they're getting very sick, and some of them are overdosing, and some of them are dying. So I'm going to shift gears for a little bit before I open up for discussion and more conversation. This is a program that we actually learned some about in Warrenton, and SpiritWorks was a partner, and my hope is that it will be revitalized in that area, as well as the work that we're doing down here with HIPS. But HIPS is hidden in plain sight, and it's a child's bedroom, and there are hundreds of items and objects that simply are there, right? And you can buy the majority of them from Amazon, and Amazon and some of these other stores, and people will tell you that there is a good use. So there is a good use for a Darth Vader grinder. Most people who are good cooks don't necessarily want to buy the Darth Vader grinder. They may want a grinder for their oregano or whatever that spice may be, but they're not looking for the Darth Vader one. So, again, that the reality and the honesty is that these things are being marketed to children and youth. What people are doing with those grinders is they are, shakes, twisting, and they're grinding their marijuana to go into a vape or Juul or whatever the case may be. And so if you see that in your child's room, what we ask people to do is to simply start a conversation. And we actually will teach you, some strategies around how to start that conversation of what you see. So you're looking for risky behaviors, you're looking for, the prevalence of substances, different magazines, we see a lot of clothing. And sometimes the clothing we see, the kid doesn't even know what they're wearing and the parent doesn't know what they're purchasing, but somebody else is wearing it in school. But what it really is it's a strain of marijuana and it means I'm selling it. So we talk about the different emojis that are prevalent, that we want people to know. There's a whole language of emojis that, you can buy drugs, you can have them mailed to you, and people wouldn't even know. And you're thinking it's a smiley face or something crying with eyes or whatever the case may be. And these are ways that our young people are being communicated with, to purchase drugs. You're walking through school, you see a bandana in a particular pocket, it means something. You see looking at Adidas, but it has a Z on the end of it, but it has a 3 stripes. So you wouldn't necessarily know, what's there. And so what we offer is a male teenage bedroom that's got, things that are hidden right there. You'll see your Darth Vader grinder. You'll see things like a spoon, several spoons, something to pay attention to. You're seeing soda cans that have been there for much longer than somebody needs to drink a soda. That may be a stash safe where you just turn it and the top comes off of it. So just being able to know, kind of things that are there, start the conversation. So it's a bedroom that people go through and just kind of learn about it. And then we actually have a PowerPoint presentation that goes along with it, where we actually can talk a little bit more deeply about specific substances, about specific behaviors that we're seeing. It's where we get to talk about people with drugs who are being trafficked, other risk behaviors that we're seeing. And it really helps to shape conversations and kind of break the ice, so to speak, to have some of those conversations with children. We started it right before COVID. I think we got 2 presentations in, and COVID shut us down. So we are making our way back. We're making a comeback, and again, it's something that we offer through our Williamsburg area, because we didn't want to, go full blast back up there without being respectful of the efforts that had been made by the police and sheriff's department, with us as partners, not necessarily with us taking the lead. One of the things that we are learning in community is the value of our partnership with law enforcement, and we always want to keep that. And parents in particular are a bit leery because they're so afraid, or you all are so afraid, that your children are going to be arrested or punished. And so it's a different kind of conversation, and one that's often not had. Some of you may or may not know that I've been in recovery from addiction for 36 years. And in talking with a friend last week, my addiction, my active use ended when I was 22. And so my drug career, if you will, was when I was in elementary and high school and college. And somebody said, well, gosh, where were your parents? And my parents were there. They were around. And what we surmised is that, gosh, they didn't really want to know, because they didn't know what to do about it or what they could do about it. And they didn't want me to get in trouble. That was one of the prevailing things, which understandably so, was of tremendous concern to them. Drugs these days, one pill can kill. It's a very different environment. the way people use these days, the way dealers have customers these days. It's very different than it was even 15 years ago, never mind 36 years ago. So it really is important to be part of those conversations with your children. And if for some reason you cannot be, is to find ways to get them connected to some of the resources that are in the community. Oh, yay. Thank you, Bridget. A HIPS presentation by Fauquier County Sheriff's Office. I'm glad to hear that at the high school. Beautiful. So it has started up again. I'm glad to hear that. Thank you. All right, let's keep going here. Oops, I pushed the wrong button. So some of the other responses that we're seeing, which are pretty exciting and amazing. One of the resources that we encourage people with through our center is the Never Use Alone. It's a harm reduction strategy. Harm reduction being just that, to attempt to reduce the harm of people who use drugs, not necessarily to get them to stop unless it is their desire to do so. But this idea of never using alone. So that's a 24/7, 365-day hotline. And you can call that, right before you're going to use. They have you stay on the line. And they've got, a peer on the other end who, if need be, can call 911, can provide you support in the moment, and they've had a tremendous amount of success, such that they are going to grow that program, so because they're getting an overload of people who are reaching out for that resource. It's a national resource. And so again, these are folks who usually are not looking to stop using, they are looking to stay alive. And so they will call that 800 number. Here in Virginia as well, our governor recently announced the Right Help Right Now program and has put millions of dollars into the behavioral health system. I had the good fortune of being invited to participate on 2 of the work pillars, one looking at resources for treatment and looking at what we need to do to expand treatment services in Virginia, and the other one looking at the barriers to recovery. And, I am confident that we were heard. We were told to bring recommendations from our respective work pillar. And we're already seeing some of the fruits, if you will, of the labors that we advanced. The work group that I was on, one of the work groups that I was on, I had they said, go out there. And if you know me, I went out there. And it actually made it to be, I think, the 4th recommendation that came from our work pillar. And that's for a safe consumption site. And it's certainly something that I'm happy to talk with anybody who wants to talk about it, because there's a lot of fear, there's a lot of myths and misinformation about those places and the people who frequent them. Harm reduction strategies work. There's never been a death in 30 some odd years of safe consumption centers being open and available. They're not for everyone, but for those, and in some areas, some cities, some towns, it's the right help and it's available right now. And so we'll see whether or not it makes it all the way through. And if it doesn't, the conversation has been begun. And, it is the #1 intervention to save lives. And so if we really are serious about saving lives and removing this scourge of these drugs being peddled to our friends and families, then we will get ourselves educated and take a look at that as one of the many strategies that are out there. One of the things that I learned in early recovery is that if I kept doing the same thing over and over and expected different results, that's the definition of insanity. And so with this opportunity and this time, and the commitment of the leadership of our governor, and certainly those who work directly with and for him, transforming the behavioral healthcare system in Virginia is really exciting. This is also the year of the peer, and that has to do with the peer workforce and celebrating the recovery champions that are in the workforce, building a more unified workforce for peers, as well as peers being able to build better bridges to the clinical community. I was a keynote speaker a couple of days ago for one of the conferences for Year of the Peer. And one of the things that I have brought forward was, not only do we need to do a better job building bridges to the clinical or treatment community, we need to actually do it with the larger community. Most people don't know what a peer is. Most people don't know what recovery is. Some of the studies that have been done around recovery, people think people are still using, and that they're kind of trying to do this thing, and that they struggle forever and ever and ever. So again, lots of misinformation, lots of opportunity. And the Department of Behavioral Health and Developmental Services has put forth an effort for this year to be able to highlight the work that's being done by peers, and tasking peers to get out into the community and make sure people know that we're here, what sets our particular vocation apart from others. This next one that I'm going to highlight briefly is One Choice. And, if you're like me, you overpay attention to use. And sometimes we make the assumption that everybody uses, all the kids are out here using drugs and everybody uses drugs. And what we know is that there are over 59% of high school seniors have not used any substances, and that 31% of them have not used substances in their lifetime. And so, everybody isn't using. And part of why I often hold up this One Choice nonprofit is because there's a tremendous amount of resources that evidence-based scientists, the first drug czar and the first director of NIDA, Bob DuPont, is the person who started One Choice with his daughter. So the science is there, the evidence is there for people to be able to, particularly I commend this to school systems, so that you all can look and see some of the resources, some of the toolkits that are available, so that, you can encourage people, instead of, the flip side of one choice can kill someone, one choice to not use drugs can also save somebody's life. And so again, there is to have a much more balanced approach to this issue, so that we're not scaring people for no reason. The next one, and Corey, I saw your question, so thank you for tossing it up for me, is to talk a little bit about some of the other resources in terms of what we're seeing. We have a recovery core worker who is who works out of our Warrenton Recovery Center, and she's called a project coordinator. It's a wonderful program that has been brought to Virginia. Recovery Corps is actually a branch or division, if you will, of AmeriCorps. And so these are folks, recovery navigators are required to be in recovery, but they can be deployed, for lack of a better word, in all kinds of different agencies here in Virginia. And recovery navigators are actually providing direct peer support services for individuals, families. And then project coordinators, which we've got a project coordinator up there, as I mentioned, and her project is she would like to put a naloxone vending machine somewhere in Warrenton or Fauquier County, and we are close to being able to secure the machine. she and I continue to talk about what's the best place for the machine. We know that naloxone is now going to be sold over the counter, beginning hopefully in the summer. What we don't know is how much it's going to cost, and what we also don't know is who's going to sell it, right? So there is no requirement just because it's going to be sold over the counter to sell it. And we've read that there are some stores, some pharmacies that are not willing to carry it. We were doing better, if you will, and maybe, and I don't know this, so this is something that I need to look into, is will that now change? Because before, pharmacies were required to carry it. They might not have it in stock, but they would then be required to order it. Will that be the case if it's sold over the counter? I don't know. So that's something I'll have to get back to you on. Corey, looking at some of the things that are put in these opioid rescue kits, you see, the bag, once you use the nasal sprayer, you want to put it in a bag so it can be thrown away, instructions on how to use it, information about recovery if people want that information, fentanyl test strips, which I'm struggling with, and I'm happy to talk about that in a few minutes, gloves, and then the actual Narcan nasal spray. Sometimes people put bottles of water in there. Sometimes people in Virginia, needle exchange is a thing in Virginia, but there are some barriers to allowing folks to do it. And so it's a work in progress where advocates are not giving up on having syringe exchange. So sometimes you see that as well. Bottom left, what you're seeing, and I was sharing with somebody earlier, is that there are xylazine test strips that are available for purchase. They're hard to get. They're not impossible to get. So knowing that those are available, most people who are using drugs don't want to die. That's not why they are using them. So being able to test what could be in there is really important. And for me, that piece of fentanyl test strips, I tell everyone to just trust that whatever the drug supply is full of fentanyl, right? So last year, 77% to date to the where we are now with the information, 76% of the people who had died by fatal overdose in Virginia, there was fentanyl there. And so, to me, it says that the presence of fentanyl could be assumed. And so therefore, people using some of the harm reduction strategies, and certainly, for me, it's like, if I only could buy one type of test strip, it wouldn't be a fentanyl test strip. It would be a xylazine test strip. And I would make the assumption that fentanyl was present, knowing that organizations, families, even harm reduction organizations don't have the budgets to have all of these things. But to have the xylazine test strip, I think is a wiser purchase. The center where you're seeing the little things that look like Visine, that's actually the reagents, and they test for, I think this one can test for 12 maybe different drugs. So this is a pretty robust reagent. And so somebody could bring whatever it is that they're going to use, or they could buy this and have it in their own home. But you can test it and see what's in it. Does it have methamphetamine in it? Does it have THC in it? Does it have cocaine in it? Does it have heroin in it? So, if you've got the resources, we see this often in some of those harm reduction centers, safe drug consumption centers, where people bring their drugs in, and you can dab it and kind of experiment and see what is in this supply before you use it, with the hope of being able to stay alive, because the folks are going to use it anyway. I mentioned the Narcan nasal spray, which will be available over the counter. The promise is by summer. They then need to let us know how much it's going to cost. So we know that it saves lives, that it has saved, thousands upon thousands of people's lives. There's now another one version that's out. I don't think it's going to be the over-the-counter version that actually is more than 4 milligrams per unit or sprayer. That is available, because with fentanyl, because of the potency, it sometimes takes more Narcan to reverse that overdose. And then the final one that is there is, we have one in our center there. We have one in our center here. We encourage anyone and everyone to get an overdose aid kit. And in our aid kit, we have the Revive bags. We've got actual Narcan in there because SpiritWorks is licensed by the Board of Pharmacy in Virginia to dispense Narcan. We've got the instructions on who you need to call. We've got some of the face masks. Much like you would have a regular first aid kit in your building or in your home, we encourage everyone to have an overdose aid kit, and can certainly help people build those kits, can actually help people get these boxes. There are also other kinds that aren't, quite maybe as elaborate as this particular one is. It also normalizes the issue and removes some of the stigma when you have this side by side. We also have door stickers on our buildings. The Recovery Center in Warrenton has that sticker. We have the same sticker on our centers here. On some of us on our computers, you can get in a lock zone here. We've got Recovery Ally stickers on our computers, on our doors, so that people know that we are safe people to talk about these issues with, and that we will do anything and everything we can to support people to stay alive and to remain in recovery, or to get to this place of recovery. I'm going to stop sharing in just a second for questions and responses, but just really want to say thank you. Certainly to Bridget, thank you to all of those of you who came today. I am Jan, the Executive Director, and that's how you can get in touch with me. Christy Piet, who you see on the left of the picture there, is in Warrenton, at the Warrenton Recovery Center on Culpeper Drive Avenue, one of those two. She's our CPRS up there. That's where Kelly works out of. It's also, so Christy's title is Operations Manager. Boots on the ground, amazing energy. We couldn't do what we do without Christy. And then Becky Box, who I know is here with us today, as well as our Chief Operating Officer, oversees, both of our centers, as well as daily operations for the work that we're doing. So I'm going to stop sharing and say thank you. Go ahead.
Thank you so much, Jan. This is wonderful information. I certainly learned a lot, and I hope all you who attended did as well. Like Jan mentioned, SpiritWorks does have a center in Warrenton, so you can stop by and find any of these resources that we have discussed. Christy is great there. She's always very helpful, and she provides social support for people in recovery, which is also wonderful. I did want to mention that we do have a survey, so please complete that as you leave today's session. And thank you. Thank you, Jan. Thank you, everybody. And have a wonderful day. I will follow up with a list of resources as well as the recording.
Perfect. Thanks, everyone.